Hello, my name is Hayley. I'm one of the speech and language therapists here in Leeds Community Healthcare. The aim of this video is to show you some of the screening tools that we have available in Leeds and to provide some advice on how best to complete them. After this video, please get a screen and have a go. For any further advice, please contact us.
We have 4 screens available for children and young people between the ages of 2 and 11 plus.
All of our screens have a mix of observational checklists and activities to carry out directly with the children and young people.
If the child or young person is not well known to the individual completing the screen, it would be best practice for that individual to liaise with the child or young person's family members and other professionals who are more familiar with them. This is in order to gather as much information as possible to come to an informed decision regarding which criteria in the checklist they may meet. Where activities involving the use of objects or pictures are carried out directly with the child or young person, it is important that the objects or pictures are all on the table in front of them with no other distractions in view.
So listen, are you ready?
When being asked for the objects or pictures, once the child or young person has passed them to you or carried out an action with them, they should be placed back in the original position before the next question is asked.
And the pig in the tractor.
There are some key points to keep in mind when assessing a child or young person's understanding of spoken language. These are: always ask the question or give the instruction as it is written. Do not break it down into chunks, as this will not accurately reflect the child or young person's understanding. If the questions have to be repeated, it is important not to do this once the child or young person has started to answer or carry out an action, as this will break the instruction down and again not accurately reflect their level of understanding. Do not give any clues to the answers. This can be nodding as they start to respond in the correct way, looking at the item they need to choose, pointing, or even telling them that they are right or wrong. Positive feedback can be given, but in the form of good sitting, good thinking, and so on.
Once the screens are complete, score the sections up against the criteria and note down which sections the child scored in red, amber, and green. If the child has scored in the red section, then it is advisable to refer to speech and language therapy. Complete the referral form in as much detail as possible and attach the completed screen. In the meantime, consult our online toolkit and follow the advice from the relevant sections. If you require further advice and support to carry out the screens, please check the website for dates of any upcoming training sessions.